Assalamu alaikum everyone. Today, our focal point of discussion revolves around the profound significance inherent in cranial anatomical landmarks. This presentation shall delve into both the overarching importance of these landmarks in a general context, as well as their specific relevance when delving into the meticulous realm of forensic studies and autopsies. Without further ado, let us embark on this enlightening journey. Cranial landmarks are specific anatomical features on the human skull that serve various purposes in medical and forensic contexts. These landmarks are essential for identifying individuals, conducting anthropological studies, and aiding in the investigation of medico-legal cases. Here are some prominent cranial landmarks and their medico-legal importance. 1. Sutures. Estimating age through the examination of cranial sutures is a common practice in forensic anthropology. Cranial sutures are the joints or lines of fusion between the bones of the skull, and they undergo specific changes as a person ages. Sagittal suture. This suture runs along the midline of the skull, midline joint between the parietal bones. In forensic anthropology, changes in the closure of this suture can provide age estimates. On assessing the sagittal suture in young adults and children, this suture remains open or shows minimal signs of closure. As an individual ages, the sagittal suture begins to close from the back or posterior to the front or anterior. Closure typically starts in the 20s or 30s and continues throughout life. Coronal suture. The joint that connects the frontal bone with the parietal bones. It can also offer age-related information. Evaluate the coronal suture, which connects the frontal and parietal bones. In young adults, this suture may still show minimal closure, with serrated edges. As age advances, the coronal suture gradually fuses, typically starting in the 30s or 40s. Lambdoid suture. Located between the parietal bones and the occipital bone. Examination of this suture is important for age estimation in forensic cases. Examine the lambdoid suture, located between the parietal and occipital bones. Closure of the lambdoid suture is one of the last to occur. It may start in the 40s or 50s and continue into old age. Supraorbital ridge, brow ridge. The supraorbital ridge, also known as the brow ridge or brow bone, is a bony prominence located just above the eye sockets on the frontal bone of the skull. It is one of the important landmarks of medico-legal importance while doing autopsy on unknown putrefied bodies. Some important points I will be discussing here. Ancestry determination. Sex determination. The presence and size of the supraorbital ridge can be used as a biological indicator for determining sex. In general, males tend to have more prominent and robust supraorbital ridges compared to females. This feature can be helpful in sex estimation of skeletal remains. Age estimation. Facial reconstructions. Identification. Forensic investigations. In criminal cases, trauma or injuries to the supraorbital ridge may be relevant in determining the cause of death or injury. Examination of this area can provide evidence of blunt force trauma, fractures, or other injuries to the skull. Age-related changes. The supraorbital ridge can change with age, particularly in older individuals, due to bone remodeling. While it is not a primary indicator for age estimation, it is considered along with other age-related cranial features. Nasion. The nasion is the midpoint on the frontonasal suture where the frontal bone meets the nasal bone. It is used as a reference point in anthropological assessments and facial reconstructions. It is positioned near the bridge of the nose and plays a crucial role in cranial and facial measurements. Here's an explanation of its significance and medico-legal importance. Nasion serves as a reference point in various cranial and facial measurements, both in clinical and anthropological contexts. Facial morphology. The measurement of the distance from nasion to other cranial or facial landmarks can provide valuable information about facial morphology and proportions. Forensic analysis. Nasion, along with other cranial landmarks, is used in forensic anthropology for age estimation, sex determination, ancestry assessment, and the identification of human remains. Facial reconstruction. In forensic investigations involving unidentified human remains, the position of nasion is a critical reference point for forensic artists and experts when creating facial reconstructions. It helps establish the correct proportions of facial features. Sex determination. Differences in the position or size of nasion may be observed between males and females, contributing to the biological profile of the individual. Age estimation. Ancestry assessment. Identification. Forensic pathology. In cases of trauma or injury to the cranial and facial regions, knowledge of nasion's location can be crucial for forensic pathologists to assess the extent and nature of injuries. Facial trauma. In cases of facial injuries, fractures, or deformities, the position of nasion may be used as a reference point for reconstructive surgery planning and assessment. Glabella. The glabella is the smooth area of the frontal bone, just above the nasal bridge. It is the smooth, slightly depressed area between the eyebrows and the nasion. It is used as a reference point in cranial measurements and age estimation. It is significantly important for facial morphology. The glabella is an essential feature in facial morphology and aesthetics. It influences the appearance and symmetry of the forehead and contributes to the overall appearance of the face. Forensic analysis. Facial reconstruction. Facial trauma analysis. Identification. Age estimation. Sex determination. Facial symmetry. The glabella is important for assessing facial symmetry, which can be valuable in facial trauma analysis, cosmetic surgery planning, and reconstructive surgery. Superciliary arch or superciliary ridge. The superciliary arch, also known as the superciliary ridge or brow ridge, is an anatomical landmark located on the human skull, specifically on the frontal bone. This ridge runs horizontally along the upper portion of the orbits or eye sockets just above the eyes and eyebrows. Can vary in prominence among individuals. The superciliary arch has both anatomical and medico-legal importance. Bony structure. It represents a prominent bony projection or ridge on the frontal bone, particularly in adult males. Can vary in prominence among individuals. Sexual dimorphism. Superciliary arches are generally more pronounced and prominent in males than in females. This difference in size and shape between sexes contributes to its medico-legal importance. Sex determination. In general, males tend to have more prominent and robust superciliary arches compared to females. Age estimation. Facial reconstructions. In forensic investigations involving unidentified human remains, it helps establish the correct proportions and appearance of the forehead and eyebrows. Identification. And forensic anthropology. Mastoid process. The mastoid process is a bony projection behind the ear. It can be used for age estimation and sex determination. The mastoid process is an anatomical landmark located on the temporal bone of the human skull. It has both anatomical and medico-legal importance. The mastoid process is situated behind the ear, specifically behind the external ear canal or external auditory meatus. It is a bony projection that can be palpated externally behind the earlobe. The mastoid process serves as an attachment point for various neck muscles, including the sternocleidomastoid muscle. Age estimation. Sex determination. Identification. Facial trauma analysis. Forensic anthropology. Stature estimation. While the primary use of the mastoid process is not for stature estimation, it can be considered in combination with other skeletal measurements to contribute to the estimation of an individual's height. Mental eminence. The mental eminence is the bony prominence of the chin. It can provide information about ancestry and age. The mental eminence is an anatomical landmark located on the human mandible, specifically on the anterior, front, surface of the lower jaw. It is both anatomical and medico-legal importance. The mental eminence is situated at the midline of the mandible, just below the lower lip. It is a bony prominence that can be palpated externally on the chin. The mental eminence serves as an attachment point for several muscles involved in chewing and facial expression. Identification. The presence and characteristics of the mental eminence can be used when comparing skeletal remains to ante-mortem records, such as dental records, photographs, or descriptions. It plays a role in the identification process, especially in cases involving unidentified human remains. Age estimation. Sex determination. Facial trauma analysis. Forensic anthropology. Facial reconstructions. And ancestry assessment. Maxillary incisor teeth. The condition and alignment of maxillary incisor teeth can be used for age estimation, especially in children and adolescents. The maxillary incisor teeth are a group of teeth located in the upper jaw, maxilla, and are comprised of the central incisors, lateral incisors, and sometimes the canine teeth, cuspids. These teeth have medico-legal importance, primarily in the context of dental identification and age estimation. There are 4 maxillary incisor teeth in total, divided into 2 central incisors, central maxillary incisors, and 2 lateral incisors, lateral maxillary incisors. Dental identification. The maxillary incisor teeth are important for dental identification, especially in cases where dental records or dental radiographs, X-rays, are available. Dentists and forensic odontologists can use dental records to compare ante-mortem dental information with post-mortem findings to confirm the identity of a deceased individual. Age estimation. Dental anomalies. The presence of dental anomalies, such as missing or extra maxillary incisor teeth, can provide unique identifying characteristics. Facial reconstructions. Comparative analysis. Individualization. Dental identification can individualize remains, especially when other forms of identification, example, fingerprints, DNA, are not available or feasible. Facial bones. Various cranial and facial bones can be used for facial reconstruction to assist in identifying individuals in forensic cases. Facial bones collectively refer to the bones of the human face and include various structures. These facial bones have anatomical landmarks and medico-legal importance in various forensic and clinical contexts. Here's an overview. Nasal bones. These small, rectangular bones form the bridge of the nose. Zygomatic bones or cheekbones. These bones are located on each side of the face, contributing to the prominence of the cheeks. Maxilla or upper jaw. The maxilla forms the upper part of the facial skeleton and includes the upper teeth. Mandible or lower jaw. The mandible is the lower jawbone, housing the lower teeth and forming the lower part of the face. Other facial bones. There are several other facial bones, including the lacrimal bones, palatine bones, and others, each with its own unique location and function. Now we will discuss medico-legal importance of all facial bones. Identification. Facial reconstructions. Facial trauma analysis. Facial bones are examined in cases of facial trauma, injuries, or fractures. Forensic pathologists assess the nature and extent of facial injuries, which can provide important evidence in cases of assault, accidents, or homicide. Age estimation. Sex determination. Ancestry assessment. Comparative analysis. Forensic experts compare the features of facial bones to those of potential matches to confirm identity or rule out individuals in cases involving unidentified human remains. Crime scene reconstruction. In criminal investigations, facial bone injuries and fractures may provide clues about the circumstances leading to an individual's death. Understanding the nature of these injuries can aid in crime scene reconstruction. Facial bones are integral components of the human skeleton, and their examination plays a significant role in forensic anthropology, forensic medicine, and the medico-legal investigation of human remains. Sphenoid bone. The sphenoid bone is a complex cranial bone located at the base of the skull. Wedged between the frontal bone anteriorly, temporal bone laterally, and occipital bone posteriorly. The sphenoid bone has several important landmarks, including the sella turcica, which houses the pituitary gland. Abnormalities in this area can have medical implications and may be discovered during post-mortem examinations. Complexity. It is one of the most complex bones in the human skull, with multiple parts and processes, including the body of the sphenoid, lesser wings, greater wings, pterygoid processes, and the sella turcica. Sella turcica. The sella turcica is a saddle-shaped depression within the sphenoid bone that houses the pituitary gland. The size and shape of the sella turcica can be important in clinical contexts. Abnormalities in this area, such as pituitary tumors, may have medical implications and could be discovered during post-mortem examinations. Age estimation. Identification. Facial reconstructions. Forensic artists use the morphology of the sphenoid bone, including the sella turcica, to create facial reconstructions of unidentified individuals. Ancestry assessment. Comparative analysis. Forensic experts compare the features of the sphenoid bone to those of potential matches to confirm identity or rule out individuals in cases involving unidentified human remains. Crime scene reconstruction. Facial trauma analysis. Medico-legal importance of cranial landmarks. Cranial landmarks are crucial in forensic anthropology for identifying unknown human remains, determining sex, age, and ancestry, and providing insights into the individual's biological profile. In criminal investigations and mass disasters, cranial landmarks can aid in the identification of victims. In archaeological and anthropological research, cranial landmarks help scientists study past populations and gain insights into human evolution and migration. Age-related changes in cranial sutures and landmarks can be valuable in estimating the age of unidentified individuals, especially in cases involving missing persons or unidentified human remains. Cranial landmarks may also be used in facial reconstructions, which can provide investigators with visual representations of what an individual may have looked like in life. Overall, cranial landmarks are essential tools in forensic science and anthropology, contributing to the identification, profiling, and understanding of individuals in medico-legal investigations and anthropological research. As we conclude our presentation, I sincerely hope you found it both informative and accessible. If you haven't already, please consider liking and subscribing to our page to stay updated with our fantastic educational content. We look forward to reconnecting with you in our upcoming video. Until then, take good care.